There is an update on Pfizer's coronavirus vaccine. The company announced that it's ending trials with data showing the immunization is 95% effective, Anne-Marie.
Yeah, it's great. This final analysis comes just 1 week after the initial results, of course, from the trial showed that the vaccine was more than 90% effective. And you know, many people celebrated that news as well. And just 2 days after Moderna announced its own vaccine was 94.5% effective. Pfizer says it will apply for emergency use authorization in the coming days, and that's what that 95% effectiveness helps to get them. Meanwhile, as Vlad mentioned, the country continues to deal with spiking coronavirus cases. We are seeing increases almost across the entire country. Some 47 states, I believe, are now in the red zone for the coronavirus, Vlad.
Yeah, and you can see on this map here, only Vermont and Maine, Anne-Marie, are not. A report from the White House Coronavirus Task Force does show that those 47 states are in the red zone. And get this, more than 1,700 deaths were reported yesterday. Folks, that is the highest single-day death toll since May 15th. David Begnaud reports.
You know, here in Newark, New Jersey, which is practically a suburb of New York City, it takes you about 20 minutes from Manhattan to get here. Their test positivity rate at the height of the pandemic back in the spring was roughly 68%. They imposed mitigation measures and they dropped it to near zero. Now it's climbing. It's up near 20% and rising.
With parts of Newark, New Jersey reporting 50% test positivity, the wait in line to get tested can be several hours.
It makes you a little nervous because you don't know if you're going to be able to get tested or not.
Right now, Newark is forcing businesses to close at 8 p.m. And they have a 9 p.m. curfew for the hardest hit neighborhoods. Mayor Raz Baraka says cities like his are barely getting by without the funding and guidance of the federal government.
Cities are trying to do what they can. It's just a free-for-all out here because there was no national strategy.
That free-for-all is exactly what Dr. Anthony Fauci warns is going to complicate not only the response of the current wave of new cases, but the eventual distribution of vaccines.
We need some fundamental public health measures that everyone should be adhering to.
He calls the state-by-state response disjointed despite the best efforts. Take these 7 bipartisan governors in the Midwest. They all issued a joint call for people in their states to follow public health guidelines.
Mask up, Indiana.
Mask up, Minnesota.
Mask up, Michigan.
But even the policies on masks vary between those states. And every day the death toll continues to climb. Lindsay Wooten says her mother, father, and grandfather were all in the same hospital with coronavirus. And while Lindsay's father survived, her mother, Tracy Larton, and her mother's father, Bert Porter, did not.
I was sitting in my mom's hospital room. I called my grandpa and I put him on speakerphone. And he said, "Trey, I'm dying." And she said, "Dad, I am too." And he said, "Then I'll look for you in heaven."
Her grandfather died within an hour of that call on October 11th. Larson, her mom, died on October 29th with her husband Chad by her side. Wooten says before the virus tore through her family, she was one of those who didn't think COVID-19 was all that real.
They did. Now, I didn't.
Oh.
Me, I was one of those that said, this is no different than a cold or the flu. And I was proven wrong, not once, not twice, but 3 times.
We have some news on the vaccine front. Pfizer says it has completed its vaccine trial. It's got all the data it needs to turn over to the FDA, and it will do that immediately. They say the vaccine is 95% effective, especially works well in older people, and virtually has no side effects. One more thing. The FDA just last night gave approval to the first at-home rapid test. Now, you're going to need a prescription from a doctor in order to get the testing kit, but if you're able to get it, you'll get results within about 30 minutes. Vlad and Anne-Marie, back to you.
All right, David, thank you very much. For more on this, let's bring in Dr. Neeta Ogden. She's an internal medicine specialist and immunologist. Doctor, we want to talk to you about Pfizer's announcement with regards to their vaccine. But I just have to, again, because that vaccine is not going to be distributed for quite some time. And the New York Times has an interactive map that just shows you the growing surge across the United States. And if states were countries, here's the global ranking of new cases per capita this week. North Dakota is number 1, South Dakota is number 2, Iowa, Wyoming, Nebraska, Wisconsin, Minnesota, Montana, Illinois, and number 10 is another country, Montenegro, followed by Kansas. So that's where we are right now. The vaccine news is wonderful, and everybody is cheering for this. It means that the end, hopefully, is near or on the horizon. But talk to me first about the surge in cases. And I know that everybody's, clapping and applauding this vaccine, but where we are today, we shouldn't be here if people had just across this country taken the measures that were called for by the CDC.
So true. I'm so glad that you're bringing this up because, yes, it's such hopeful news that we have a vaccine on the horizon. But all I can think is that there are dark days ahead. We have been backed into a corner by this virus, largely because of so many missteps early on. We did not need to be in this position, largely because of, like you said, the lack of this mask mandate. Now we see these governors and legislators in the Midwest backtracking and coming out a little too late. Honestly, it's never too late. But honestly, if it had been done earlier, we would be looking at a different landscape right now. Also, never a national strategy to deal with this pandemic. That means that states and governors were left to deal with this themselves. We could have easily put the brilliant public health officials that we have in this country in charge of that, instead of having politicians take the helm and create the message around COVID. And that the same thing goes with testing. There wasn't any ramped up testing. At this point, with the level of sort of industry that we have in this country and the innovation, and it's there and it's happening, we should be able to have rapid tests that we can use on a daily basis. These are the measures that would get us out of the pandemic and start leading more of a normal life and not be where we are now, where there are these incredible surges. It's terrifying to healthcare workers, to nurses, to people. And we're in a situation where simple steps that we have now, like testing and tracing, are just no longer effective. We have to be incredibly careful. So there's a long road ahead before that vaccine arrives at most of our doorsteps. And this Pfizer vaccine, we've all been reading, I think, about kind of the logistical uphill battle it's going to be to get it to everyone in the United States. So until we actually have that kind of immunity that has 70 to 80, over 80% of people vaccinated or immune, it's not really going to make a dent in how we are able to emerge from this pandemic.
Yeah, we talked a lot about the Pfizer vaccine yesterday and the fact that it needs to be kept extra cold, so it needs to be transported in its own special packaging. And so it's good to have, at least 2 vaccines on the horizon that look like they are very effective. But both of them, I think you need 2 doses too, so they come with their own distribution complications. But I want to talk about something that you brought up that we also need, which is proper testing. David's piece talked about the FDA approving or giving authorization for the first at-home rapid test. There's a couple of hiccups because you need a prescription for it. And I didn't quite understand what portion of it was at home, because it seems like you have to submit the sample and put it into something. But can you talk about what we know about this test and when it could become more widely available?
No, exactly, Anne-Marie. I think that when I read about this test, I was scratching my head as well. Yes, I think that it bodes well for where we're headed, which is an at-home test. But what we really need is like a pregnancy test. You buy it, you take it, and you read it. You don't need an extra device. The fact that you need to get to a doctor and have that step of, or in some way getting a prescription for this, you're adding time and middlemen. So I think it's something that's great in the sense of the theme of rapid testing here is what we need, I'm a little hesitant about how useful this test is going to be if people need a prescription. And again, it is emergency use authorization, so it's not really clear how quickly. It might be a matter of weeks next month that we see it being rolled out. But until, again, I keep saying this, we have more of even just a rapid antigen test, which are not as sensitive. But if you take them serially and you take them every day, or even if we had testing that we could take twice a week in our own homes, that would be a game changer. This kind of stuff would be a game changer. So and this test also, just to be clear, does test for nucleic acid. So it's not a antigen test. So perhaps it's more accurate, but there's not much more information about it at this point.
Doctor, I want to focus on something that you said just earlier, but I perhaps didn't understand it clearly. So if this vaccine is made available to the public and people start to get vaccinated, you said something interesting. You said that where we are right now with the cases surging, the infection surging, and the grim reality that follows after, are you saying we're past a point where having that vaccine would... I'm just trying to understand exactly if this runaway surge means that even if we have a vaccine, we're still facing some really dire circumstances in this country.
Oh, yeah, definitely. And that, when we look at how they're planning to roll out the vaccine with essential healthcare workers and people with underlying high-risk conditions getting it first, and they say that about 20 million of those people will get them by December, end of this year. And then there are other essential workers, and that most people without medical conditions, it would be more like April, May, June, and July. So think about what's happening now, and it's November until then. There's going to be a lot more cases and a lot more deaths, especially in the absence of a national strategy. And we're frankly in limbo here with the current administration not even providing the incoming administration with the tools to get things started. It's quite frankly terrifying. And even if we continue to see these surges and people getting sick, it's still not going to get us to that magical herd immunity, which doesn't exist. We still will need people to participate in vaccination to finally see those numbers and enough people with immunity in this country that we can safely move around in schools and our workplaces without masks. So what comes in there, and what have we needed all along? A massive public health message and effort. Polling shows that people in this country fall into kind of three groups. There are about 50% of people who actually say, I'm going to wait on the vaccine and let my friends get it and see how they do. About 30% of people, they say, sure, I'll sign up. And then there are a lot of skeptics in between in there as well. So a lot of work needs to be done about educating the country about what the vaccine, all this data that we're talking about, the 95% effective, let's break it down so people understand. Let's really get the message out there that this was seen across race, age, and different gender, so that people understand that they're being spoken to as well, that they may be able to access this vaccine, that it could be safe for them. What does it mean for their children? We really need to start that messaging. And with this kind of limbo happening in our administration, it just feels a little dispiriting, honestly, to see that we're not necessarily on that track.
Doctor, we talk a lot about the vaccines and therapeutics and respirators, but you need people. You need trained staff to do all of this stuff. We're seeing hospitals in some regions becoming overwhelmed with the rising number of hospitalizations because of this virus. In July, a survey of 3,500 doctors by the Physicians Foundation found that thousands of doctors had closed their offices in recent months, and another 4% said that they plan to close within the next year. As the pandemic enters this new phase, what does burnout look like among doctors and nurses right now? And what might be sort of the long-term impact for many of these professionals who are used to seeing, patients in debilitating, dire condition, but this has been day after day after day for months now?
Right. And I think that's exactly what it is. It's not just a mental fatigue in terms of processing how to care for a still relatively novel entity such as coronavirus and the many manifestations it has, from just the respiratory to the clotting to this vasculitis that we see it develops across all age groups. But it's physical. It's long hours that are stretched on for days and days. And we're seeing this play out largely with nurses, like that North Dakota, they've been told that if you're asymptomatic with COVID, I'm hoping that has been reversed and they're not doing this. You can go to work because they are experiencing shortages. Nurses are being asked to work in departments where they have no experience. They're asked to work in longer shifts or in rural areas where they're seriously understaffed. In nearby Philadelphia, I was reading about how staff is going on strike because not only were they, prior to the coronavirus, they were already feeling a lot of stress and that they couldn't really meet the demands of the hospital. And you can only imagine now when we have these hospital systems, really on the brink, how they're responding. I think ultimately, if we come out of this, physicians, because many people talk about other pandemics on the horizon. What does that mean for doctors? It's not a very hopeful outlook to think unless we develop, again, a national strategy, greater surveillance, we're prepared in advance, hospitals are prepared immediately, doctors will feel like this is a less than appealing occupation that can lead to incredible stress, burnout, fatigue, and that's why so many people are closing their doors.
Yeah, and to work under those conditions and then leave your job and go to a store and see people perhaps not wearing masks or not social distancing, I can't imagine how disheartening it must be for so many doctors out there. Dr. Neeta Ogden, thank you so much.
Thank you for having me.